Researchers from the U of A's College of Medicine in Phoenix say they've come up with a way to identify any future health conditions in a child before it's born. And as 9 on Your Side's Rogelio Matos reports, that method could be helping mothers as soon as later this year.
Working on the
KGUN 9 caught up with Detective Jennifer Crawford from the Tucson Police Department. She says they're still investigating sex trafficking cases from last year, and while there haven't been any
And we apologize for that. We will try to get you that story later on in the show. An inauguration like nothing seen in recent memory. After the break, a look at security in the Capitol right now ahead of Wednesday's transition of power. You're watching KGUN 9 on Your Side. Researchers from the U of A's College of Medicine in Phoenix say they've come up with a way to identify any future health conditions in a child before it's born. And as 9 on Your Side's Rogelio Matos reports, that method could be helping mothers as soon as later this year.
Very hard conversation.
Dr. Avi Patil is an educated man, educated enough to know there are still things he doesn't.
One of the big gaps in knowledge is around what to expect from the baby after birth.
For more than 6 years, he says, researchers from the U of A's College of Medicine in Phoenix have teamed up with others from Indiana University. Their goal was to identify potential health problems in children during pregnancy using hormones from mom's blood.
By going through this sort of screening, it allows us to better understand who's at risk and who do we need to put more resources towards to make sure we're doing everything possible to keep them and their pregnancy as healthy as possible.
Dr. Patil says they're closer than ever, and the work is ever important now during the COVID-19 pandemic.
There's not any clear data that COVID-19 will make a woman more likely to deliver prematurely.
But that doesn't mean there isn't still a risk, he says. Expecting mothers are much more vulnerable to the virus and any illness because their immune systems are weaker during pregnancy.
It's because that baby that's inside is genetically it's half her, but it's also half dad. And that half dad portion is foreign to mom.
Whether expecting mothers should get the COVID-19 vaccine, Patil says that's up to them and their doctor.
Up until now, there's never been a good way to truly assess the outcomes for the infant after birth from within pregnancies.
There are follow-up studies to be done and federal guidelines to meet before the method can be applied to mothers everywhere. The College of Medicine reports 1 in 10 mothers affected by premature births. Patil says this research will help them and their doctors care for the child when it's finally available. Rogelio Matos, KGUN 9, on Your Side.